Okay, so welcome back everyone. In this video, we'll be discussing about chorea. Now, chorea is a basal ganglia disorder. So this disorder makes you look like the patient is dancing. So you can see the rhythmic involuntary jerky movements. So there are rhythmic involuntary movements which looks like the patient is dancing. So it's very interesting to know that this word chorea, this comes from the Greek word for dance. Now I'll be discussing that what is chorea. Now chorea is a movement disorder that causes involuntary, irregular, unpredictable muscle movements. So you can see that there is involuntary, there is irregular, and this is unpredictable. It's jerky, rhythmic movements. So what is the pathophysiology here? So you need to remember that in normal cases, like when we look at the circuit of the basal ganglia, in normal cases there is a proper balance of neurotransmitters which goes into the nucleus of all the nucleus of basal ganglia and it gives a final output. But here in brain with chorea there is an impaired output. So as you can see the arrow here, I have marked this is the lesion in the subthalamic nucleus. So either from the lesions of the subthalamic nucleus or from disordered regulation of subthalamic afferents, the final output to the brain is impaired. So this causes involuntary jerky movements. This makes sense. Now, one more thing to notice here is that there are two main features, that is the randomness and the flowing quality, and also you can see motor impersistence here in this subject. Apart from this, when we look at the image of this chorea, so here you can see there is choreoform movements. So based on the time course, this can be sporadic or genetic. In sporadic, you can see that there are structural or metabolic dysfunctions. In children, you can see the syndrome chorea. In adults, Huntington's disease is seen. And also based on the site, we can rule out many diseases. Like if suppose the forehead is involved, then Huntington disease is seen. If hemichorea is involved, then Syndam's chorea can be seen, or there is structural lesion on the contralateral side. So this was a brief video on chorea. Okay guys, thanks for watching.